Hello, Best Self community, and welcome to the For Your Best Self podcast. This is Dr. Saluja, co-founder and dermatologist at Dermatology Plus Plastic Surgery For Your Best Self. And today I'm excited to role play as a patient who is asking questions about Semaglutide and Tirzepatide, the new weight loss wellness medications. Not so new anymore, but still ever popular. This weight loss wellness is a program that we have recently added to our practice. And I'll tell you a little bit more soon on why we added this service. But I wanted to welcome Kristen, Roff, nurse practitioner, to the podcast first. Welcome, Kristen.
Yeah, hi, thank you.
Kristen, we have brought in the two medications because we hear about it all the time. You know, I first started hearing about Ozempic as a diabetes medication, and then more recently as Wegovy, and then compounded semaglutide as a weight loss medication, and then also some wellness benefits from the medication, and then a step up Tirzepatide. And I see it in the context of rapid weight loss and facial aging. So patients ask me about, you know, the Ozempic face, which really has nothing to do with Ozempic, but just weight loss that occurs too fast. And then we also, you know, hear about side effects from the medications. And I really want to highlight some of the benefits, some of the side effects too, but really some of the benefits of the medications and why, when done properly, it can be life-changing and health-changing for patients. And then also, from a plastic surgery option, a healthy body mass index, or BMI, is a must before and after surgery. And there's data that GLP-1, this class of medication, has improved body mass index, so it's also healthy as an adjunct to surgical solutions. So anyway, I am going to get off my doctor chair and become a patient. Tell me a little bit about yourself, Kristen.
Yeah. So, hi, Dr. Saluja and For Your Best Self family. I'm Kristen Roff. I'm a nurse practitioner. I've been board certified and practicing for 9+ years. Originally, I'm from Kansas, but my family and I relocated to Colorado and then to Florida recently. I have 3 kids, 2 dogs, a husband. When my husband first mentioned the move for his job to Florida from Colorado, I was pretty resistant, not thrilled. I was very well established in Colorado, but surprise, surprise, I love it here, and I'm so happy to be here. I couldn't be happier to join the practice, and we're all thriving. But as a nurse practitioner, I've been blessed to practice in multiple specialties, but my focus has been aesthetics and dermatology, including neurotoxins, fillers, laser treatments, skin cancer exams with treatment, complexion issues, skin care, and wellness with weight management. And I couldn't be more thrilled to join Dr. Saluja, your outstanding team, and help launch the wellness program.
Awesome. Okay, so tell us a little bit, and tell me a little bit about semaglutide, Tirzepatide. I struggle with Tirzepatide, just the name, so bear with me. How did they work? Why would I want to start? I would love to lose 10 pounds.
Yeah.
Always.
Yeah. We all, I think, have 10 pounds to lose, or most of us. But yeah, they are, they're most commonly known as GLP-1 medications, and they both are GLP-1 medications, but Tirzepatide also is a GIP medication. And they work by glucagon-like peptide, right? Goes into your system, tells your body, increase your insulin secretion, decrease your glucagon secretion, delays your gastric emptying. And so obviously the insulin and glucagon, that is the effect for diabetes. That's why the drugs were created. And then as a byproduct, they also noted that it had significant weight loss results, which were safe, we have come to now find out. So it works in the pancreas by increasing that insulin, decreasing the glucagon secretion, which regulates our blood sugar levels. And then it works in the stomach by slowing the emptying of our stomach. So it makes you feel full quicker after, like 20 to 40% of what you would usually eat. And then you feel full longer because it stays in that stomach longer. And then third, it also works in the brain by quieting the receptor in our brain that causes that, we call it quote unquote hunger noise. So that kind of background, like, oh, I think I need a snack, right? Or, oh, I'm craving chocolate. I'm hungry, even when you're really not hungry. So it quiets that down, we say. And semaglutide does all of that. Tirzepatide also works as a GIP, so it works on a separate receptor in the brain to quiet that hunger noise. It's kind of like the newer version of semaglutide, if you will. Fewer side effects, a little better efficacy. In the clinical trials, they saw semaglutide had an overall weight loss of 15% for the average person, and then tirzepatide was about 20%. So it gives a little bit better or a little bit more results, not better, but with less side effects.
How are these medications given? I think most people know.
Yeah, they're once weekly injectable into the subcutaneous tissues. So epidermis, dermis, subcutaneous. So it's a really tiny
needle. So in
needle.
your stomach, thigh?
Yeah, stomach, thigh, back of the arm if someone else is doing it for you, or some people are talented enough to do that themselves. But yeah, into those areas.
Who's eligible for, we talked about these initially as diabetes meds. Is this a problem that we're using it in people who don't have diabetes for weight management?
Yeah, good question. BMI makes you eligible. So anyone with a BMI, the FDA indicates it for anyone with a BMI of 27 or over, 27 to 29 with comorbidities, or over 30 without comorbidities. But on a case-by-case basis, we can give it with a BMI under 27 as well. It's kind of up to the provider's discretion.
How does somebody know what their body mass index is?
Yeah, you take your weight and your height. It's an easy calculator, and then you put that in, and it gives us our BMI.
Okay, so just need weight and height for that.
Yes, ma'am.
What's your typical patient that you're seeing?
Good question. So I have a lot. The majority of my patients are women who have gone through menopause, and the things that they've done all their life to kind of keep their weight healthy are not working. That's, I would say, the most common patient I have, and so it's working well for them. Or it can be a man who's retired and his physical activity isn't what it used to be, and so he needs a little tool to get him back down to where kind of he wants to be, and then sustain it from there. And I also have younger people who have tried everything and nothing is working, and so they use it as a tool. Status post gastric bypass patients are another one I get a lot, so that they can come in and safely take this medication after a gastric bypass to get back to where they want to be.
Interesting. Putting my dermatologist hat back on, one of the reasons it's exploded in dermatology is that it's been shown to help a lot of inflammatory skin diseases like psoriasis. A less common one, hidradenitis, have improved with decrease in weight and just improvement in metabolic conditions. So one of the benefits of these medications is in some of our skin patients, they haven't had to use immunosuppressive medications, and they have been able to improve their metabolic health, which has then allowed their weight to come down, which has also improved their skin disease. So are these medications better than the phentermine medications that we used to use because of that metabolic?
Yeah, in my opinion, yes, they improve kind of. If you're decreasing your glucagon secretion, right, you're decreasing your sugar levels, you're decreasing inflammation in your body. Decreasing your weight, you're also decreasing inflammation in the body. But they have these secondary factors that help, like PCOSers, right, with their insulin and management of that for them, that I think do help with all these other things in their lives. And whether or not it's weight reduction, right, simply weight reduction versus what the medication is doing elsewhere, I think that we have yet to see the research on a lot of that because it hasn't been studied for 20 plus years like a lot of things. But phentermine has a lot of risks associated with it, right?